dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show for Tuesday, May 12th, 2020. We're going to be joined on the program this evening with Dr. Adrian Legaspi. He's Medical Director of the Center for Advanced Surgical Oncology. It's in Hialeah. It's on the campus of Palmetto General Hospital. You hear us a lot show about that great hospital in Miami-Dade County. And I think we had Dr. Legaspi on in 2017, so you may remember that talk on surgical oncology. We're so lucky to have him again on the program. So without further ado, Dr. Legaspi, how are you doing this evening?
I'm doing very well, David. Thanks very much for inviting me to the show.
And thank you for taking the time to call in because as things have slowed down in some types of healthcare, you tackle the diseases of cancer. So I want to get right into it. I kind of phrased this question because I've been talking to a lot of different doctors about surgery and what was halted and what, kind of still went on. Had elective surgical oncology procedures been halted, and have they since resumed? Can you give us the latest on that?
Well, yes, David. Once the pandemia was becoming very widespread, we had to hold all the surgical procedures for cancer. There were only a few emergencies that we had to do. But now that we have rapid testing to see if the patient has an infection with coronavirus or not, all the surgeries that we had put off for precaution, now we are able to resume it. So those patients that need to have surgery for cancers are being treated now as long as we test them and as long as we know that they're not infected with coronavirus. So little by little, we have been able to reestablish a normal operating room schedule, and that includes all types of surgeries from very complex to fairly simple.
That's great news, especially, because you do surgery for, cancer treatment. So that's great news that, things are moving forward with a little bit of protocol there, which is, going on everywhere. We've learned during this pandemic, how to put the brakes on, and we will get back to things in the future. Tell us a little bit about the Center for Advanced Surgical Oncology, because, I've been there a few times, and it is one of the most impressive offices, not just for the, the physicians that you've brought on, and I know we're going to be talking about another physician here soon. I was just looking at an amazing resume of a physician you'll be on later this year. We'll talk about at another time, but Yeah, it's a huge waiting room. It's very comfortable. It's very accessible. Palmetto's easy to drive in and out of. Obviously, there's the valet there. It's a hub in the Hialeah community and Miami-Dade. So tell us a little bit about your practice and the Center for Advanced Surgical Oncology.
Well, the Center for Advanced Surgical Oncology has been in existence for over 5 years. It's right now integrated by 3 surgeons and 2 advanced nurse practitioners. We have a very well-established operating room team with an expert surgical coordinator, an expert first assistant, expert anesthesia, and expert scrub technicians. That is something that has helped us do very complex and sophisticated operations. We do many of our abdominal surgeries using the latest technique of robotic assisted technique. And we've been doing pancreatic surgery, gastric surgery, liver surgery. As a matter of fact, we had some of our data presented in electronic form at the meeting of the National Comprehensive Cancer Centers. We had a series of robotic colon resections, and another technique that I think we're the leaders in South Florida and perhaps in the state of Florida of destroying liver tumors with microwave ablations. The surgeon that is going to join us later in July has been trained at some of the more well-known cancer centers in the country, and he's going to be adding a different perspective and in the management of head and neck cancers, including thyroid surgery, and also that complements our expertise with breast surgery.
That is great news. Yeah, like I said, I had a chance to look at his resume, and it's one of the most impressive that I've seen in the few, years I've been doing PR and healthcare. So that's great news. We'll get him, out there as well in the news. So you talked a little bit about liver cancer there. I know you're known for the microwave ablation technique. Is that still one of the main, procedures used or treatments used in treating liver cancer today? I imagine there's all different, each case is different. You have a whole, I always say with doctors on the air, you have a lot of tools in your toolbox. And I know, you're obviously a South Florida expert and international expert in this field, but is microwave ablation something that you use the majority of the time for liver cancer?
As you mentioned correctly, we do have a variety of tools in our toolbox. Microablation is one of those, and I have a preference because it is fairly straightforward in terms of good results to destroy tumors in the liver, in particular that in patients that are sick, that have underlying associated conditions like cirrhosis, or patients that had previous surgery for cancer of the colon. So the survival rate of this operation is extraordinarily good, and the complication rate for this procedure is very, very small. Many times we can do the entire treatment without having the patient gone elsewhere to get a biopsy and then get treatment. It's a one-stop shop. The patient goes under anesthesia. We establish a diagnosis and we do the treatment, and you're usually out of the hospital within a day or two with very little risk. So for me, has been a very useful tool to treat patients that are high risk for other type of more invasive operations of the liver. We still tailor the treatment for each individual patient based on what's going to be, in my judgment, the best possibility of cure with the least risk of complications.
And that's great news as well. We're here with Dr. Adrian Legaspi. He's medical director of the Center for Advanced Surgical Oncology. They are located on the campus of Palmetto General Hospital in Hialeah. The address is 7150 West 20th Avenue, Suite 615, Hialeah, Florida. Dr. Legaspi is bilingual in English and Spanish, and he's on staff right there at Palmetto General Hospital, right on the campus. Great campus, great hospital. Everything's right there, so it's so great to have him right on the campus. You know, Dr. Legaspi, you know, pancreatic cancer has obviously been in the news for the last I want to say almost a year. I think it's been over a year with Alex Trebek speaking a little bit on it, of what he's been fighting it with a very positive attitude and getting the awareness on it. Now, for pancreatic cancer, what are some of the common treatments available through your practice and the hospital there?
Well, for pancreatic cancer that gets discovered at times that can be operated, you have operations that remove part of the pancreas or all of the pancreas. Most of the time, we remove only part of the pancreas because the risk of complication is less. In the surgical community and the community of surgical oncologists, one of the most challenging pancreatic operations is what's called the Whipple procedure. The Whipple procedure basically entails removing the part of the pancreas that's adjacent to the stomach, to the bile ducts, and the small bowel. It's an operation that typically is done with the open technique. We now have started doing the operation with a robotic technique. That means that instead of having a big incision that goes across the abdomen, we do it with small incisions, and also I can pass the instruments of the robot and be able to complete the operation that way. Other operations of the pancreas involve other portion of the pancreas, all of which we do also robotically, and all of them we've had very good outcomes with very little complications. So pancreas continues to be a challenging organ to operate. Pancreatic cancer continues to be a very challenging disease to treat. But of those patients that are well selected, we think we have very good outcomes in terms of having a successful operation, a successful recovery. Most of the times we'll combine the operation with systemic chemotherapy as a preventive. So this is another important part of the practice that we have. My two associates are experts also in pancreatic surgery. So I think we can offer the patients a very wide variety of options with good expertise and good outcomes.
That's great news as well. We're here with Dr. Adrian Legaspi. It's dradrianlegaspi.com. You're going to put in your browser adrianlegaspi.com. It's Legaspi. The number's 35820-6657, and I'll give that again before the end of the broadcast. You can see it on the screen if you're viewing from social media and you're not listening on the radio airwaves. So we will get that out again. Dr. Legaspi, you mentioned robotic a few times, and I always like to let the viewers and listeners know a little bit about it. So this is a robotic, it's a robotic assisted surgery. You're still in control, and can you tell us a little bit about the benefits, starting with the minimally invasive, procedure that really is beneficial to patients?
Yeah, I think that robotic surgery offers very distinct advantages. Number one, It allows the surgeon to see with much more detail and three dimension the inside of the abdomen, whereas where I use it mostly. We also have the ability to inject dye that can tell us what organ has enough blood supply and which one doesn't. And also, very importantly, prevents having the abdomen open for extended period of time during surgery, where the patient can lose fluids and can lose heat. The recovery is also better and quicker because instead of having a long incision across the entire length of the abdomen, there are small incisions, none of which is bigger than an inch. The except would be if we have to take a tumor out that measures 2 or 3 inches, then you will have to enlarge it a little more. But the fact that the incisions are very small are very allow for a very rapid recovery. The need of pain medication later on is less. And once the skills are well mastered for the surgeon, the risk of complications is very, very small. We also been able to minimize the risk of blood transfusions due to the really excellent imaging that you have and the ability to identify the blood vessels clearly that can be controlled or ligated before you cut through them. So for me as a surgical oncologist that is doing operation in the stomach, the esophagus, the liver, the bowel, this is a tremendous advantage. Obviously, not everybody's a candidate for this surgery, but I would say the great majority of the patients will be good candidates for the surgery. We've done over 400 complex surgical oncology intra-abdominal procedures in the last 5 years. So that has allowed us to have a very broad range of expertise. We also are fortunate to have very well-trained assistants that allow for the surgery to go very smooth and to be done in shorter periods of time that otherwise they would have been done. The Department of Pathology here at Palmetto is excellent. So we always have good, accurate information about tissue that we need to analyze while we're operating. And then we have a complement of excellent nurses in the recovery room and the specialized surgical intensive care unit. We also have a surgical floor that is dedicated only for the patients that have cancer surgery for quick recovery. So I think we've put together a good center of oncology that extends from the initial phone call to make an appointment to the moment they leave the hospital and then follow-up visits in the office. We always like to check that the patient is recovering well. We want to make sure that the wounds are healing well. And very importantly, we have to be able to manage the disease that we operated. Any surgeon can do an operation to remove a piece of the colon, a piece of the bowel, but the key is to be able to understand clearly the biology of the disease and to be able to coordinate multi-specialty treatment for those patients to give the best opportunity for cure.
That is a great explanation, Dr. Legaspi, starting with robotic surgery and going on to surgical oncology care there. Again, Dr. Legaspi is on staff at Palmetto General Hospital. Their website is palmettogeneral.com. Take the time to look at that site. It's a brand new site. There's a lot of info on it. And again, Dr. Legaspi's practice is located right on the campus there as well. We still have a few more minutes. I know we're getting through a lot of different of your areas of interest. There's so many, though, so I encourage everyone, again, go to dradrianlegaspi.com. You'll see all the diseases and conditions treated by Dr. Legaspi, as well as his areas of interest, education and training. There's a lot of info there. If you were looking to learn more about any surgical oncology, treatments, procedures, etc. Esophageal cancer. This is one that I don't really, I'm a PR guy, a writer, and I don't really see much on this. I think it's talked about less in the mainstream, and I may be wrong. I'm more of the general public here. So tell me a little bit about esophageal cancer. How it's what it affects, how it's treated. Because like I said, I don't see much on it in the mainstream, and I may be wrong.
Well, the reason why you don't see a lot of the mainstream is because it's not a very frequent cancer. Most of the times it affects two distinct group of patients. Ones that drink and smoke, and the other ones that are affected with gastroesophageal reflux disease. And each one of them has a distinct type of cancer. Now, the other reason why it may not be very popular in the media is because the type of specialists that take care of this cancer overlaps. There are many thoracic surgeons that are experts in the management of thoracic cancer. Some esophageal cancers are best treated by a combination of chemotherapy and radiation. So it would be non-surgical treatment. You would have a medical oncologist giving chemotherapy intravenously, and a radiation oncologist that will treat the tumor with radiation. There are going to be some cases that the three specialties have to coordinate care to deal with the patients, and most of them has to do with the stage of the disease. Now, robotic surgery has also revolutionized the management of the esophageal cancer with surgery. You could conceivably do an operation to remove the entire esophagus through small incisions in the chest, or some of the operations that I do is, if it's a cancer of the esophagus that is close to the junction of the stomach, many times we can resect the tumor from inside the abdomen without having to open the chest. There's going to be other times that without having to open the chest, you remove part of the esophagus from the abdomen and then connect it to the esophagus in the neck. So how it's treated and how it's tailored will depend on what the initial treatment is best and how he responds to that treatment. There are going to be some patients that never need to go to surgery because they had a very good response with initial treatment of chemotherapy and radiation. There are other patients that have a tumor that is blocking the esophagus that you need to actually put a stent to open it up so they can eat, and then the patient can get treated. There are going to be a few patients where the tumor is bleeding that is better to take it out first with surgery rather than wait until they have some benefit from chemotherapy or radiation. So that's some of the reasons why it's not been too often talked in the media. And the other thing that we have to be realistic about it, we don't have any celebrities that have been recently diagnosed with esophageal cancer. So if the celebrity doesn't get a cancer that you treat, your cancer is not going to be very well known.
Yeah, that's a great point, because we always, brighten up for some reason when we know a celebrity that we follow has it, But and then on the other side of that is they give awareness. But Dr. Legaspi, hard to believe we ripped through 30 minutes, but I just want to thank you again for giving us a look into surgical oncology. I have to say that was fascinating.
Well, I want to thank you, David, for the kind invitation.
Thank you, and we'll talk to you next time. on the You and Your Doctor Living a Longer and Healthier Life show. Again, check out dradrianlegaspi.com, Center for Advanced Surgical Oncology, 320-6657. We'll see you next time on the You and Your Doctor show. Thanks again, Dr. Legaspi. Have a good night. Stay safe.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.